Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soulé.
Hello there, and welcome to Community Conversations. I am Vicki Soulé, the CEO of Treasure Coast Community Health. And as most of you know, we provide primary medical, dental, behavioral health, and a whole lot more because we are a federally qualified health center. And that means that we take care of the entire person. And so every second week of August, we celebrate with all the other community health centers around the nation in National Health Center Week. To do that, I've asked 2 of our site managers to come in and talk to us about what kinds of services they offer, what kinds of jobs they have, what kinds of benefits there are in coming to a community health center, and maybe even debunking some of the myths, like it's only for poor people. So I am pleased today to have 2 of my wonderful gals here, although it is going to be a challenge for all of us because Michelle Cox is here with us from our Sebastian site, and Nichelle Rains is here. Yes, you heard that right. One with an M and one with an N, as in Nancy, she says. Nichelle Rains is here from our 787 site. And so I welcome both of you. I know this is the first time you've been on radio, and Facebook makes it even more overwhelming, but you guys have just done a tremendous job in keeping our centers running smoothly. You know what we do very well. And so I'm hoping that you won't freeze up completely and we'll carry forward. And I know all of our staff are going to be cheering from you at the sidelines. Michelle, you've been with us even longer than I have been here. I'm not going to ask you the number of years because that would mean that we both started when we were 15, right?
Exactly.
But when you first joined Community Health, Treasure Coast Community Health was not even Treasure Coast for very long at that time. Where were you stationed and what were you doing?
When I started in the Fellsmere location. And we had just been Treasure Coast Community Health for maybe 5 years at the time. And we had 2 locations, one in Fellsmere and one in Vero at the 777 building. And since then, we've gone from 2 locations to 7 locations.
A lot of changes.
Yes, ma'am.
And you weren't a site manager there. You were, when I met you, our admin assistant.
Correct. I actually started working at the front desk. And I have worked my way up the ladder to site manager.
And that's not uncommon in our organization to see people work their way up the ladder, is it?
No, ma'am. Most of our site managers have worked their way up from front desk to site management.
And Nichelle, you have been with us a much shorter time.
Yes.
When did you start with Treasure Coast?
I started about 1.5 years ago, a little bit over 1.5 years.
And you were not a front desk person first?
No.
So what did you do previously?
Previously, I worked for a breast cancer organization, and I was their event manager and fundraising department manager.
So you knew a little bit more about the social services aspect and about running nonprofits in terms of squeezing that last nickel.
Oh, yes.
Oh, yes, she says.
Oh, yes.
Well, we celebrate National Health Center Week every year, and it's a recognition that health centers take care of a large variety of people. Michelle, out in Fellsmere, who's our favorite? I shouldn't say favorite. What population do we see a lot of there?
In the Fellsmere location, It's mostly the Hispanic population that live out in the community, but we see anybody who comes to us.
And Michelle, here in Central Vero, we also see anyone who comes with us. Again, rural versus a more urban. Do most of the folks that come to 787 have insurances?
Yes, they do. Some of them do, but some of them don't. So we see a nice mix of both. There,
okay.
Since we're centrally located.
But you do not have the common thread that many of our other sites have. And what is missing?
We are an adults-only facility. So
Yes.
At the 787 office, we don't see for pediatrics.
Okay. And, if you've seen one community health center, you've seen one community health center. There is no right or wrong in terms of the way that things are set up. but we differ from year to year and site to site based on the guidance of our board of directors. And Michelle, you've worked with our board quite a bit. What's the key word there in terms of what are the requirements to be a board member?
The board members have to, 51% of the board have to be actual users of our services.
So the other 49% come out of the general community based on their expertise, whether it's
finance, law, accounting, whatever it
fundraising.
Be. Fundraising.
But we cannot have any of our staff employees be on the board, obviously.
Correct.
Okay, so these are folks that are completely unrelated to us that use the services and then help us with things like
how to improve our services. What are we not doing that we should be doing?
And I pick on you because not only have you worked with the board, but when we have our staff meetings, they know that the changes are coming, right, from our board of directors guidance, whether it is the hours that we keep, whether we have pediatrics at all locations, which again is up to our board to determine. And that is pretty much the traditional, if mom comes in with a baby, then she's more likely to bring her own care and her husband's care to it. What did you see as the advantages of not having pediatrics at one of our sites?
It just allows you to actually focus on mom or dad who's there, to where they actually have a spot where they feel like it's just specifically catering to them and their needs. So they're there for their own primary care, and it just gives them more of a feel-good spot to know that this is their time, their health care, and just a little bit more feel good for them.
Yeah, and they don't have to worry about some snotty-nosed 2-year-old coming up and going,
right.
me. Right? Yeah. I'm sure you've gotten that feedback along the way.
Yes.
So, Michelle, you have pretty much the exact opposite. You have a very robust center up in Sebastian that sees adults, kids, behavioral health people for counseling. What kind of feedback do you get from your patients in terms of that mix of generations and types of needs?
Our patients are grateful because they can come to the same location for multiple things. They can come for themselves. They can bring their children. They can bring their children and themselves for counseling. So it really works out for the entire family. And they like that our docs and counselors talk to each other so that they're familiar with them and what their other issues or problems may be.
And so when we talk about the two sites that you have, neither one of you has dental services. How do you handle people who need dental care that have come in and they've seen their doctor or their counselor, and then they say, I have this toothache. I guess I'm going to have to find somebody.
Well, we have brochures, and they're very comfortable with speaking with us, and we give them the contacts that, we make a warm transfer so that they know that we're all in the same department, but we just don't offer those services at our center. So it's an easy handoff to the other dental department. We just pass them over to that scheduling.
Okay. And if someone started at your center but then moved northwards towards Sebastian, do they have to reestablish? Do they have a separate medical record? How does that work, Michelle?
No, they do not have to reestablish. They will meet with their new provider, and all the records are the same. We share the medical records across all 7 locations. So any provider that does see the patient will have all their information at their fingertips.
Okay, but you kind of scared people off there, I'm sure, with the records are available at all locations. They're not available to everyone, though.
No, ma'am. You have to have passwords and logins to get into our medical records.
Into specific areas of your medical records?
Yes, ma'am.
Okay. Just want to be clear. So the folks that are seeing a behavioral health counselor, do they, many people are lacking insurances these days. What do you advise people to do first?
Just to come in and talk to someone. Let us know what's going on so that we can help you, because Treasure Coast Community Health does offer services for people whether you're insured or not insured. We have a sliding scale fee that will allow them to still get the same quality of care, but at a reduced price. It is application based, so it's based on your household income and your household size. size. But just speak with us and let one of our medical front desk receptionists know that you're interested in finding more about that program, and we can give them all the information at that time.
So in the case of today's COVID situation, can they just call instead?
Yes, you can definitely call. We are very proactive with practicing social distancing. So we do want to make it convenient and easy for the patients as well as the staff. So yes, we do have those options available for phone appointments if they would like to qualify for that.
And who do they ask to see or talk to?
They can ask to speak to one of our healthcare navigators, and they will be directed to one of them after they speak to one of the front desk receptionists.
Okay. Michelle, working on this. I'm going to call for a short station break, but when we come back, I'd like to have you talk about some of the other changes you've seen, not just over the years, but certainly in this time of COVID and telehealth. Okay? We'll take a short break from a word from our sponsors.
Why did the countdown stop? Because it's the countdown to Buzz TV channel 1098, Comcast Xfinity, and it's here. Local content for Sebastian Vero and Fort Pierce. Tune in for local info, happenings, and fun, including all the great Planet Vero TV shows from 8 to 10 a.m. and p.m. Dial in channel 1098 for Buzz TV on your Comcast Xfinity box and discover what the buzz is all about.
Hi, I'm Vicki Soulé, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not. And at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org.
Visit board-certified, fellowship-trained vitreal retinal surgeon Dr. Robert Reinauer at New Vision Eye Center. Vitreal retinal surgery is required to fix many of the diseases of the retina, macula, and vitreous fluid of the eye. Dr. Reinauer's core focus is the surgical care of the retina, including retinal detachments, medical treatment of dry and wet macular degeneration, and diabetic eye care. Your eyesight deserves world-class eye care. Visit newvisioneyecenter.com or call 772-257-8700.
ITEX, or International Trade Exchange, is the largest barter company in the world, with over 25,000 members offering goods and services. We're a marketing company that brings you new business in the way of trade, with over 200 local members enjoying the benefits of ITEX, like lawyers, doctors, plumbers, media, printing, and more.
Hi, this is Liz Bowler. Contact me and find out why barter through ITEX has been smarter for over 30 years. 772-532-1881. Visit itex.com.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
And welcome back to Community Conversations. This is Vicki Soulé, and welcome back again to our discussion about community health centers in general, because this week, going forward, is National Health Center Week, a celebration of the 1,400 nationwide community health centers that provide care for everyone, regardless of their ability to pay, their age, their race, their preferences of anything at all. We see them all, and we're so happy and proud to be able to do that. So this is a week where we celebrate the differences between us in terms of recognizing that some people get some assistance through public housing, and we're there for them. Some people work as migrant or seasonal farm workers, and we're there for them. Some folks are homeless, and we, again, take care of those folks. And then we have our vendors, our partners, our community partners that work with us to make all of this possible, because we are only primary care. And as the saying goes, it takes a village to raise a child. It takes a community to care for a whole community's healthcare needs. And so we recognize our partners on one day, and most especially, I'm proud to say that we recognize our staff at the end of the week because they do so much for so many so willingly. And so in celebration of that, we will be doing some activities for and around the community. Some of that has changed from years past because of social distancing and mask wearing and making sure that we don't share anything at this point in time, especially the unwanted big C. But I've asked my two of my 7 or 8 or whatever site managers, they all roll up their sleeves. Michelle Cox, who's been with us for some years, and Nichelle Rains, who is at one of our newest centers and also takes care of some of the needs at our United Against Poverty site, which we just opened less than 6 months ago. So we've been having quite the discussion about what is a community health center, what kinds of folks come there, what kinds of experiences these two have had. And I'm going to divert the conversation back to Michelle because she has a number of behavioral health folks actually at her Sebastian Center, tucked in there between medical and pediatrics, which makes it nice because then people don't have any idea what you're coming in for. It's sort of that anonymous factor. In a small town feel, at least, even if demographically we are no longer small town, we kind of still operate like one, and it gives you a sense of, is everybody looking at me? And no, they're not. They're just thinking, wow, they're going in for care, and that's great. But the volumes of people coming through our doors has changed, and in part that's because we have initiated that through our telehealth program. So, Michelle, you were there when we started it up in about 3 days in March. Kaboom! That is the wonderful thing about being a community health center and not waiting for someone from the state or federal government to tell you what your community needs. Before we made that decision, we compiled all of our board of directors together on a Sunday afternoon and talked about the immediacy of change and what we thought would be recommended. And they were very much into us doing telehealth. So how does that work exactly, Michelle?
Well, a telehealth appointment is basically the same as a regular appointment, except for you're doing it via Zoom. And it's HIPAA compliant Zoom meeting. And you log in, you're face-to-face with your provider. The receptionist will call you and verify all your demographic information. Excuse me, then they transfer you to the medical assistant who asks the medical questions, and then you get to see the provider, and they go over any issues or things that you might be there for.
I'm sure that has posed a lot of challenges for people who were not technologically savvy or who might have had some phone issues, like my husband still swears by his flip phone. Can't change some old dogs. So how did you cope with those folks?
We actually, the front desk staff was trained very well on how to troubleshoot.
Okay.
And we just get a staff member on the phone and walk them through it.
Okay. So have you had anybody say, this is stupid, I'm not going to do it, I want to come in?
We have, but we usually work through it and we get them on, and everything seems to work out.
But there are folks that can still come in.
Absolutely.
Okay. And Michelle, you don't have as many counselors at your location, but you do have a lot of medical people seeing those adults.
Yes.
Do they do telehealth?
At the moment, yes. They are starting to do telehealth more and just provide that extra, those extra options to patients that request it.
Okay. But not quite as much as on the counseling side. Michelle, what makes mental health counseling easier than taking care of a medical issue?
It's really hard to help somebody in a medical position who has maybe a rash or a sore throat, something you physically have to be able to look at or touch or feel. Mm-hmm. Whereas when you're seeing a counselor or a psychiatrist, you're talking. Mm-hmm. So there's no need for them to look at something specific.
So I would imagine, particularly for children, that's more challenging to have a telehealth visit.
Yes, ma'am. It's a little harder for the children.
First off, just getting them in front of a screen for 5 seconds, right, without moving and jiggling. But
Right.
I know the pediatricians really like to see how everything is working and moving and the size measurements and all those types of
Right.
things.
They like to see them walk and, look in their ears, up their nose, in their throat, all the basic stuff.
All the basic stuff.
And they can't do that on a Zoom call.
Okay. So you are seeing quite a few moms and dads bringing their children in?
Yes, ma'am.
And Nichelle, from an adult perspective then, I'm sure that you probably see quite a few adults that perhaps struggle with diabetes or hypertension, high blood pressure, COPD, some breathing issues. So you probably have a lot of folks that come to you because they need more active monitoring and medications.
Yes.
Can they do the medication work over the phone?
Yes. Our medical assistants have really been taking the extra step to make sure that the medications are staying filled without them having to come in the office if they don't want to.
Okay. And so when you talk about them filling medications, we have 2 pharmacies. How does that work for medication refills?
Yes. So we have 2 pharmacies. We also partner with our local community members in the community to assist on the weekends at night, so assist them when we're not available for medication refills. But we do encourage our patients to please come to us first. We do have 2 locations, one at our Oslo location, and the second pharmacy is at our Fellsmere location. But again, when we're not available, we have partnered with Walgreens and other community partners to assist with medications.
Well, and I know our pharmacy director just started doing a more active enrollment of people for home deliveries.
Yes.
And that's free of charge. So again, trying to keep up with the needs of our population. Michelle, you've seen us grow from a 2-shop and then add a pharmacy and then add and add and add.
And add.
And no, I don't think we're going to add any more for a while, just in case you were wondering.
You said I don't think.
Well, when I've said absolutely not, I've
the next one comes.
Yeah, I have to fish my foot out of my mouth. What do you see as the advantage for our patients in terms of getting medications from us? Why should they do that?
Because we work on a sliding scale, so the people that are uninsured or underinsured are on the sliding scale, and when they go to the pharmacy, their medication slides as well.
So they get a big discount off of it.
Yes, ma'am. And there's a big benefit for them.
Okay. And when you talk about a sliding fee scale, that means, as Nichelle said, that they've brought in their paperwork to show their income, and they tell us about their family size. How often do they have to do that?
They have to do that every year.
Okay, once a year? Yes. Unless their situation greatly changes. Okay. And I say that because I believe that people's situations are changing, some in the positive direction and some not. So if people had a change in their household size or income, how could they identify that change? They may qualify for a discount that they weren't getting before.
They would just call us up and schedule an appointment with one of our health navigators at any of our locations, and they would go over their information and let them know where they qualify.
And could that appointment be set up as a telehealth as well?
Absolutely.
Okay. Even though they got to get paperwork.
They can drop that off.
They could drop it off or have it scanned and sent over? Okay. So, parting words, we have about 30 seconds left. Anything that you really want people to know about being at a community health center?
I love the patients. I love the staff. We have amazing doctors. So come out and see us.
Try us out.
Yeah.
Huh? Okay.
Yes, please come out. We're always accepting new patients, and we love to see you. So come out and be a part of the family.
Wonderful. Thank you both so much for being with us today.
Thank you.
You did awesome.
Thank you.
I hope that you do see new patients because that's what we're here about. We are here to help those that do not have a primary care physician to have a patient-centered medical home. So thank you both very much for being here. And thank you all for being on the listening end of our conversation. I hope that you will pass this information along. And again, if you have any questions, don't hesitate to call 257-8224 and ask for the location closest to your home. Thank you and good night.